Why didn't I match Dr. Agrawal? This is a question I've got from some of you who went through the match and didn't get the result you were hoping for. You must be feeling disappointed, devastated, upset, maybe even angry. I know I can relate to these feelings when I myself was not successful going through the fellowship match the first time. What we must realize is that it is very difficult to think straight if we are emotional or feel overwhelmed. So take the time to speak with your family, your parents, your spouse, your partner, your friends, your mentors, maybe even a therapist. We must come out of this strong. We must fully process our emotions before we begin the work of preparing for the next match season. So do one thing for me. Ask yourself, do I feel ready? If so, let's work to put in our best effort for the next match. When I meet with residency applicants to do this kind of a root cause analysis, I tell them that no one can say with 100% certainty why the match didn't happen. Mentors like myself can look at your application, understand the sequence of events, and make our best educated assessment of what may have gone wrong and what we can improve upon for the next match. The first thing that I look at is the number of interviews that applicant has received. This is the first metric that, if you will, helps me reach a diagnosis. By now, it's very clear to you that you need interviews to match. Without interviews, there is no match. So naturally, the next question is, how many interviews do you need to match? If we look at internal medicine, which is the most popular specialty among international medical graduates, does one need 1 interview or 5 interviews, 10 interviews, 20 interviews? How many interviews do you need to match? We've all come across stories where residency applicants with 1 interview matched and others who may have got, say, 15 interviews did not match. So to answer this question, I looked at the NRMP data tables because this gives us the most objective information. As per the 2024 data, on average, a non-US international medical graduates who matched had about 6 interviews. I feel this is a good number, and so I'm going to use it in the rest of my discussion. You can look up similar numbers for other specialties. So let me break this down for you. If you're an international medical graduate who applied in internal medicine and had less than 6 interviews and didn't match, then the issue is in your residency application because it just didn't catch the eye of the program director. On the other hand, if you are someone who had more than 6 interviews and didn't match, then the issue likely is on the interview performance, what happened on the interview day, or your rank order list. Okay, let me now share with you weaknesses that I've identified in residency applications that led to little or no interviews. Let's look at the personal statement. The personal statement is something that's very dear to me because I made an entire course on how to write a winning personal statement. Yet, I still see personal statements that start with a sob story, death of a loved one when this applicant was a child, or how their high school teacher inspired them to study medicine. That's all not needed. Other personal statements are very generic and you can replace, say, internal medicine with anesthesiology, and it would still, grammatically sound okay. Your personal statement need to convey your specific strengths and experiences very clearly to the program director. Next up is the residency application. I still come across ERAS applications where the applicant does not provide geographic preferences, even though there is clear data that shows that providing geographic preferences increases the chance of getting an interview invite. I've also come across ERAS applications that are missing impactful experience just because they are optional. But truly, all these data points help the program director better understand you and make a decision about your application. Next up is your USMLE performance. It is very clear that having a USMLE attempt makes it much more difficult to get an interview invitation. But I want to focus on step 3, because I've come across a good number of applicants who choose to take their step 3 towards the end of the interview season, maybe in January, just in time for the H-1B visa. What I would say is that not having your USMLE step 3 score at the time when you apply for residency and submit your application in September puts you at a little bit of a disadvantage. Having a pass on your step 3 assures the program director that you're ready for residency and very likely to pass the boards. Research. Now, generally, I've not been a big fan of asking residency applicants to do a lot of research. However, lately, seeing so much competition around, not having research experience such as posters or presentations or papers makes your application less competitive. The dreaded letters of recommendation. This is one factor that you have absolutely no control over, because there's no way you know what's written in those letters, whether good or bad. Weak letters of recommendation happen when there's limited interaction between you and the teaching attending, or there are limited opportunities for you to show your communication skills, your interpersonal skills, your clinical skills, or just because you didn't show a lot of enthusiasm during the rotations. And finally, the programs that you chose to apply to. I remember speaking with a residency applicant a few years ago who only wanted to apply to programs that had the word university in its title. Such over-reliance on university programs can backfire and is risky. ACGME accredited community hospital programs are very good to help you become clinicians or clinical educators like myself. Now let's look at those residency applicants who got a good number of interviews, say more than 6 interviews in internal medicine, yet did not match. What could have gone wrong? Their application is strong enough that it got the attention of the program directors. In that situation, I asked the applicant to reflect on what happened on interview day. Did something go wrong? Did they come across as someone who is very unprepared, who's anxious, difficult to communicate with, who is unprepared, uninterested in the program? By any chance, did you make any comments to a resident or a chief resident that did not go well? I remember sitting in a residency selection committee meeting where the chief resident talked about an interviewee making a very distasteful comment about residents in the program. This just goes to show that your every move at the interview is being carefully recorded. This also happens when you go for a second look, so be very careful because you're being very carefully observed. And finally, the rank order list. Just like the applicant I talked to you a little while ago who would not settle for anything besides university program, some residency applicants may choose to purposely rank university programs higher than community programs just because for the name and the prestige of a university program. However, doing so, they rank the community programs low, and so they lose out on the opportunity to match at these community programs. All right, now let's take some action. Here are strategies for the next cycle. 1. Make sure you're choosing the right specialty. It is A-OK to apply to the specialty that you applied in the last match. If you applied for internal medicine last year and you see yourself working as a primary care physician, you might consider applying to family medicine. If you look again at the NRMP data table, at the time that there were 2,500 international medical graduates who matched into internal medicine, there were about 400 international medical graduates who matched into family medicine. So you can see it's less crowded. 2. Shine in your US clinical experiences. Be punctual, be professional, be active. Ask for extra work, ask to see an extra patient, ask to present papers or review topics at rounds, ask to be a part of case reports or papers. When you do approach your attendings requesting a letter of recommendation, provide your list of accomplishments in that rotation. This will help them write an excellent letter of recommendation, and I've described this in my letter of recommendation webinar that you can watch on my YouTube. 3. Make sure that your application and documentation is pristine. Take a look at your ERAS application, personal statement, and make absolutely sure that you are taking every opportunity to describe yourself to the program director and show your strengths, your experiences. Even if a section is optional, grab that opportunity. 4. Broaden your view of community hospitals versus university hospitals. Community hospitals that are ACGMA accredited provide excellent clinical training, just like it did for me. They help you become excellent clinicians and clinical educators and do a job as good as a university program, maybe sometimes even better. I would highly recommend that you set your priority to matching into a community hospital program over the name and prestige of a university program. 5. Be ruthless in your networking. This is not the time to be modest. Ask every research mentor, clinical mentor, alumni from your med school, maybe a friend who's in a certain residency program, to put in a word to the program director. A word of mouth goes a long, long way to strengthening your chances of getting an interview invitation. Meet and greet sessions with the program directors at certain conferences are wonderful to open up channels of communication, and you'll be surprised how much they remember you when you do go for an interview. 6. Master the interview. Once the program agrees that you are well qualified, it is your job to prove that you are a perfect fit for that program. Prepare your very best for the interview. Go in with maximum confidence. Research the program thoroughly, ask thoughtful questions, and show your interest to the program director, the other interviewing faculty members, chiefs, residents, and anyone else in the interview. And finally, the bonus strategy, because you have stayed to the end of the presentation, boost your profile. Take step 3 early so you can provide your step 3 result at the time you submit your application. Involve yourself in courses and certifications such as point of care ultrasound course or research certifications, or maybe having research presentations, poster presentations, or publications. You don't need 20 papers, but you do need quality. As you now have a better understanding of what to work on for the next match, we at Ed4Med US are very happy to work with you. We have many YouTube videos, have highly rated courses on residency interview questions and answers, personal statement, and provide high quality services such as personal statement editing, ERAS application editing, and of course, practice interviews. We would be honored to work with you and help you in your journey to a successful US residency match. Best of luck.